Hi everybody, my name is Juan Sopena and I'm a dermatologist with more than 20 years of experience in the field of aesthetics. And it is my honor to host the first episode of these roundtables for HubMed. But before we start, let me tell you why I truly believe that HubMed is more than a platform and it's unique. First of all, we are completely independent. It has been built from doctors to doctors. So what we want is to learn and grow by sharing our experience and acquiring knowledge from doctors to doctors. The second thing is that we are completely independent. So our truly aim is to provide medical education. And finally, we will be focusing on cross-category knowledge, which means combination therapies and treatments, which I think we will all agree that it is the future in facial aesthetics. Part of the HubMed platform is going to be this roundtable series, which will focus on trending topics, every month with international experts and renowned KOLs as the ones that we have here today. Welcome everybody. If you don't mind, can you introduce yourself to our audience? So Isa, you can start.
Hi everybody, my name is Dr. Izabela Kobylińska. I am dermatologist from Poland and I run my own clinic in Gdańsk, Poland. My experience with aesthetic medicine is more than 20 years.
Hi, my name is Dr. Maya Sinai. I am a surgical anesthetic dermatologist. I've been in the field since 2010. So I'm enjoying myself. I'm really, really honored to be here. I love my job and I love learning from my peers.
I don't think there's anyone that doesn't know you, Dean, but introduce yourself.
Hi everyone, my name is Dr. Dean Berman. I'm an aesthetic physician. I live in Vienna, Austria. I've been introduced to the aesthetic medicine approximately 17 years ago, and since then I'm having a blast, both as a physician but also in different roles in major companies in the aesthetic industry, and it's wonderful to be here.
My name is Dr. Evgenia Shelemba. I'm a dermatologist. I'm in this aesthetic dermatology field since 2012. And in my practice, I always try to combine clinical experience with the new and evolving scientific knowledge. And that's why I'm here, because I want to share my tips with my colleagues and I want to learn from all of you as well.
Thank you very much for that generosity. We also have plastic surgeons in the table.
Yes.
Dr. Cohen, introduce yourself, please.
Well, Sarit Cohen, I'm a certified plastic surgeon. I'm working more than 15 years of experience. And I'm dealing with aesthetic surgical and non-surgical procedures, and I really love and fond of anatomical dissection. So I'm moderator of anatomical dissection as well.
Very good. And finally, our neurologist, Martina.
Hello, my name is Dr. Martina Blaho. I'm a neurologist from Austria, from Vienna, and I'm doing neurology for quite a while, and I'm now kind of expanded it to aesthetic medicine since a few years to combine the knowledge from neurologists now also to aesthetic medicine.
Thank you. So as you can see, we have a real wide panel of experts. And the topic for today, we believe it's very important, especially for those who are starting in the field of aesthetic medicine. And it's a little bit, what are the challenges that we found when moving or transitioning from the clinics to the aesthetics. And this is my first question to Dr. Shelemba. So what were those challenges that you as a healthcare professional encounter when moving from your clinic to traditional clinic to the aesthetic field?
So the crucial shift happens when you transition from the clinical to aesthetic, because the focus changes from the prescriptive treatment-centered approach to more holistic and patient-centered approach. And to get into this, you need the entire mindset shift, and sometimes you need to get an additional training for this. That's why we are all here. Actually, I'm going to attend all of your webinars, my dear colleagues, because I want to learn and to see how you manage expectations of the patients, how you meet the legal and regulatory expectations. how you even overcome the resistance and skepticisms from our colleagues who are more into the traditional medicine, because all of us have gone through this, and together we have a lot to share.
I liked a lot about your comments when you said a personalized or individualized approach. I think this is crucial. This is something we are going to provide here in HubMed, and it's unique because for the first time we're going to go from the patient to decide which kind of product or technology does the patient need, rather than being a company that only promotes their product and tell us how to apply it on a patient. This is the first time we're going to give you all the clues to go from the patient to the product or the technology or the device. Don't you agree? This is extremely important and something unique.
I think that it is so needed, first of all, because let's be honest, in our everyday life, when a patient is coming, they don't ask for a certain product or a company, they ask for a beautiful result. They will say, please improve my lips, please improve my tired look. And it's up to us to use all the tools that we've got in the best possible way. And the best tools that we've got is a mix and match. We take a toxin from this company, a filler from this company, biostimulations from this, energy-based devices from another, because those are the protocols or the recipes.
And we're going to explain why. Why? Because there's always our opinion on choosing this or this other product. It's based on, our own experience and, the clinical outcome. Another thing that as a dermatologist like you, Dr. Shelemba, I think what was also challenging for me in this transition from clinical to aesthetics was actually that I was dealing as a Mohs surgeon, a surgeon, a dermatologist that was focused on surgery, from the skin that was suffering a kind of disease to a healthy skin. And this is why I want to link it with a question for Dr. Cohen, how important it was in my case to learn anatomy, because I was dealing with a healthy skin. So I really needed to go back to all those basic concepts of anatomy. As a plastic surgeon, what do you think is the importance of facial anatomy in all this transition between clinical and aesthetics?
Well, I think that anatomical knowledge is paramount importance. In fact, this is the basis for successful aesthetic procedures. And we have to keep in consideration that during the last decade, our understanding of facial anatomy has evolved dramatically. So it changed from two-dimensional, planar illustration, like we are used to see in Netter and Sobota, to a complex, three-dimensional composition. The five-layered concept was introduced. New anatomical structures have been identified and known. The 6 danger zones of facial vasculature were highlighted, so to maximize safety, minimize complication. So actually, our terminology has changed considerably. Moreover, when we are talking about the anatomical changes that are associated with aging, we now know that the pathogenesis of aging is based on the basis is an anatomical basis. So I cannot overemphasize the importance of those that wants to transform, the importance of investing money and time and resources into a comprehensive training of facial anatomy, and I see the difference during cadaver dissection. So this is like a different dimension. We are talking about the third dimension, not only the surface marking, but the way that our structures, so blood vessels and muscles, are going through the layers. So this is...
Yeah, I'm very glad that you mentioned the layering, the 5 layers, because in all our events, training events, people insist about aspiration with the needles when we deal with injectables. And I think the clue is actually to know the anatomy, what I call the topographic anatomy. It's the layers, in which plane is the dangerous structure that you need to avoid. Is it at an intermediate plane, so you can go deep or superficial? I think the layering it's something crucial, and we will focus on this concept of layering or topographic anatomy in HubMed during the next, weeks and events. Yeah.
Yeah.
And about cadaver dissections, 3D. We have now new technologies that using MRI, they're trying to predict a little bit where our vessels are. What would be your recommendation for someone who's starting or is transitioning from the clinical to the aesthetics? Start with cadavers, go more to the apps. I don't know if you have, some
Well, with
experience
regard to facial vasculature, there is a huge variability. In general, I can say that the original vessels are from deep down, so layer 5, and then afterwards they are transforming intramuscularly, so more superficial, and later on the course they are subcutaneously. And this is for all the vessels in the face. Let's say the facial artery, which lies deep down the mimetic muscles, and then it is coming more superficially in that part in between the oral commissure and the nasal ala. Yes, it is crucial to understand the transposition in the layering. But of course, we should keep in mind that there is a huge variability.
So thank you very much, and I can't wait to see your future trainings regarding these anatomy concepts. And Dr. Kobylinska, we have said that how important is going to be these combined treatments, the combination of treatments to achieve better results in HubMed. How important do you think is this, and how do we access to that information, or how have you managed to do it?
Yes, we all know that to access to this information is really difficult because we all work for big companies and we provide informations working for them about their products. But as a clinicians, as a doctors, we would like to combine products and methods every day to provide the best care for our patients. So, in my opinion, to have a platform like this one, like HubMed, is very, very important. It saves our time. Also, it gives us the best access to the best experts all over the world. This is crucial.
I think someone that can add a lot more about this is actually Dean, because he now deals a lot with devices and combines treatments. How important is this, cross-treatment or combined treatment, in facial
First of all,
aesthetics?
Juan, I think it's an excellent question. And I think that this is exactly the future of aesthetic medicine that we are all aiming to have, because as someone that works with EBDs, injectables, toxin, you understand that the end goal, the results that the patients want to have, is a combination of everything. And I'll just give you a few examples of how exactly we can achieve. So when we combine certain types of biostimulators with radiofrequency, and on top of it, a few weeks later with toxin, we can literally achieve results that are, and Sarit can answer, they are as good as surgeries in some cases. And the revolutions that we can achieve today with the results is something that when we look backward, when we look of what they could achieve 10 years ago, 20 years ago, 30 years ago, was perhaps science fiction.
Right. Anything to add, Doctor?
Well, I do believe that we did an enormous advances in the last decade in concerning minimal invasive procedures.
Well, thank you so much. Very good point. And Maya, Dr. Sinai, I want to ask you about your experience with social learning, what we call social learning, which means, actually acquiring that knowledge from doctors, okay? As we all, has happened to all of us that, we go to our events, master classes, and at the end of the event, you have a queue of doctors that want to ask a personalized question, some additional information, and it's because they want your expertise, they want your tip. How important is this social learning, and how are we going to manage this in HubMed?
That's a really excellent question. I'm so glad that you asked it. I think that social learning is crucial. It is the basis of this continuous medical education that we do also amongst, just within ourselves and amongst our colleagues. Every time I go to a conference, when we're doing online training platforms, when we're learning in workshops, I always like to ask questions. I like to see what the personal experience with different products and different combinations are for the different people there, and not just the person lecturing or speaking. I think it's really, really important when you want to improve your daily practice and you want to give everything you can to your patients, that you really know what's going on with each individual material, not just your own experience, but what are the experiences of other people around you with those things. Combinations, single treatments, and the follow-up is very, very important, because you're going to get bombarded with these questions from your patients, and you need to have that experience sometimes very quickly when you don't actually have it in your clinic. So it's really, really important, if we're going to be giving the best patient care that we can, that we have this free flow of knowledge and experience and idea exchange, because that's how we all learn. Not being too scared to ask, but being open with all the information.
We're going to share everything. In
Yes.
HubMed, we're not going to keep anything, nothing for us.
No secrets.
We're going to share all our tips. And remember, this is going to be very important, because when you learn a specific tip and you apply it to 500 patients in a year, you're not learning one tip, you're applying something that it's going to be used 500 times. And we only included in this project doctors that want to share everything with you. So not only we are focusing on the traditional, aspects of facial aesthetics, we have said that we are going to focus on a global and holistic approach. And for that reason, we also have a neurologist in our round table today. So, Dr. Blaho, tell us a little bit, as a neurologist, how different was your transition, or what are the clues for transitioning from neurology to the aesthetics?
Actually, navigation between clinical neurology and aesthetic has been an enlightening journey for me. For example, in neurology, I'm often dealing with neurological pathologies that requires precision and a deep understanding of muscle and nerves. In aesthetics, I apply this precision too, where understanding the muscle and nerves is equally important for achieving desired outcomes. So it's like balancing both fields requires a mindset that values the science of medicine and the art of aesthetics, and always the patient's, of course, well-being at the forefront of any decisions.
Very good. I actually think you have a very difficult task sometimes, because you deal with medical problems like migraines, but at the end you also have a repercussion on the aesthetic aspect of the patient, the face, So I think I don't know if you want to give us a little tip about how you would modify a little bit your pattern, to respect both, both sides.
I often can combine them, of course, because the patient comes to my neurology practice complaining about migraine or complaining about muscle tension, especially in the trapezius. And the side effect is that when I inject toxin, for example, for let's call migraine, it can also reduce the wrinkles in the forehead. So it's a good combination. Or the tension that I can therapy with toxin is the side effect that the neck gets slimmer, like the Barbie trend. So it can be a good combination, and the patients are happy with the results. For the one hand, for the aesthetic result, and also for the neurological problems. But you have to value a little bit, because if you want to inject for migration, for example, you need a lot of amount of toxin, and I can't apply everything on one space, of course. So I need to value a little bit. I put some in the temples, I put some in the neck, so I can spread out and still get a nice aesthetic result, and I can still reduce the migraine.
Excellent. So we will focus on all those tips in the future. Just one last question. Do you charge them double? Because if you improve the migraine and you also improve the wrinkles, I think you should charge double.
No, that's a good part, because some of the insurance even pay the cost for the migraine toxin. So
very good. And Dr. Berman, please, how important do you think is medical education actually in facial aesthetics?
I think it's crucial. If I will have to think about it, it's way more than half of it. And as time goes by, we understand how important it is more and more, because this is a field that is changing, I wouldn't say daily, but very, very often. Trends comes and goes, and we need to be always on our tip in order to make sure that we know everything. And we need to keep in mind as well the safety of our patients. So when we remember all of those things around, and we heard all of my peers today with their wonderful tips and their experience, and when we remember things like the importance of anatomy, and the changes that happens in anatomy, the importance of new trends, new products that are coming, and the combinations of all of them, we understand that without proper medical education, we will reach nowhere. And this is perhaps the fundamental of a good and safe aesthetic medicine.
I totally agree. I think we all totally agree. Well, then this is it for today. I want to thank you all, the expert panel, for being here today in this round table. And I want to announce you that very soon we will have our second episode with a very innovative and surprising topic that you can't miss. So see you in our second episode of these roundtables for HubMed.